seeing my shared screen and what's happening in the Zoom background. And this is Ryan Austin's last of 5 years as moderator of the ASJ Journal Club and lead next generation editor for ASJ. So he's been a huge asset and friend to all of us for many, many years. He's been a mentor to many people that are coming up through the program, residents and fellows. He's professionally, consummate professional, and he's the moderator to end all moderators. He infuses innovative ideas with just kind of laughter and black tie suits, and just he's the full package. So just wanted to take a minute to acknowledge Ryan and his amazing contribution to really elevate the profile of this journal club. And Ryan, we're indebted to you, and we thank you so much.
Thank you so much. I appreciate it, Phaedra.
Yeah. And then who will be taking over for him is Dr. Maryam Zamani. She's with us here as well. You know her as the discussion curator of the Journal Club. So she will be taking over Ryan, who will be supporting us in the wings, I'm sure. So Maryam, did you want to say a word or two?
Yeah, I just want to say thank you so much to everyone for this opportunity. I'm really excited. And honestly, so many thanks to Ryan, because he's been a mentor of mine for such a long time. We were in residency together. We shared very, great clinical pearls together. I learned a lot from him. And I think we had a few great memories that we shared from there that stayed with us. But honestly, Ryan's done such a stellar job of, like you said, elevating the next generation editors and the ASJ Journal Club, and really paved the way to make this such a stimulating platform for us, and really paving the way for great conversations, great interactions with the experts. So I'm just, really hoping that I can do it justice after he's raised it to such a great status. And that's going to be my big mission for the next little bit.
Thank you so much. With that, we'll ask Dr. Okoro to share his slides, and I'll hand back over to you, Ryan, for the last time.
Perfect. Well, I certainly know that you didn't tune in to see that many pictures of my face up on the screen tonight. We wanted to talk about non-surgical body contouring. So thank you for all the kind words. It's been a lot of fun running this group and being involved. And tonight for our my final Next Generation Editors Journal Club, we're going to be talking about an article from the 2024 edition of ASJ entitled "A Novel Approach to Shaping the Lateral Abdomen, Simultaneous Application of High-Intensity Focused Ultramagnetic Therapy and Synchronized Radiofrequency at the Flanks, a Multicenter MRI Study." And as you heard, Dr. Maryam Al-Zamani, who is joining us from Los Angeles, California, will be our discussion curator tonight. So make sure you look in your chat boxes. You'll see polls pop up, so answer those as they come. They'll help to guide our discussion, and please feel free to ask any questions that you want in the chat box to keep this as interactive as possible. Certainly non-surgical body contouring is a fascinating area for discussion, no matter what the forum or venue. And, it's a rapidly evolving field, and it's been driven by technological advancements. But for plastic surgeons, it certainly can sometimes feel a little bit overwhelming and hard to keep up. And sometimes it's difficult to distinguish what's real from what's marketing and advertising. So tonight, we're fortunate to be joined by one of our authors of this month's featured article, Dr. Stanley Okoro from Atlanta, Georgia, who is going to present his group's work focused on this non-surgical body contouring technology. And we also have two expert discussants tonight with vast experience and expertise in non-surgical body contouring. Dr. Julie Khanna from just down the road from me in Oakville, Ontario, and Dr. Jason Pozner from Boca Raton, Florida. So I can't wait to hear all of your insights and thoughts on this. So without further ado, we will hand the screen over to Dr. Okoro for his review of his group's work in this month's article.
Thank you very much, Ryan. I appreciate you. We are gonna miss you. I'm honored to be presenting this paper. This is a multi-center study by 6 of us: Dr. Barry DiBernardo, Carolyn Jacob, Joe Cohen, Young Cho, and Suzanne Kilmer. I just have the honor of presenting this paper. This paper was also presented at the aesthetic meeting in Vancouver. Thank you very much. I have no disclosure. I hope you can see my screen okay, right?
Yes.
It looks fantastic, yeah.
Thank you. All right. So the background, as you get old, you have accumulation of excess adipose tissue. I know none of that happens to you guys. This can lead to declining your core stability, muscle balance, and unfavorable abdominal profile. We know that combining HIFEM, which is high intensity focused electromagnetic technology, and radio frequency energy has been shown to be safe and effective method of strengthening muscle and reducing adipose tissue on the anterior abdomen. So this study will explore the safety and efficacy of this procedure on the lateral abdomen, also known as the flanks or love handles. HIFEM, which is electromagnetic muscle stimulation, uses electromagnetic fields to stimulate intense supramaximal muscle contractions, which leads to muscle strengthening, muscle hypertrophy, and muscle hyperplasia. It's been cleared by the FDA for muscle strengthening for abdomen and for the pelvic floor. And it has been objectively studied and proven using both ultrasound, MRI, and CT scan. Synchronized radiofrequency energy, or RF, also has been shown to cause adipose tissue apoptosis when the temperature reaches between 42 and 45 degrees Celsius. It's been shown to enhance the effect of HIFEM. When we study the synergistic effects of combining HIFEM and RF to target both adipose tissue and muscle tissue. This was designed in two movable parts where there's a cross synchronized electrode that covers the entire area of the flanks. In our study, 73 patients were recruited across six centers, 52 female and 21 male. Age range in 22 and 60. That's the BMI skin type from 1 to 6. The patients or the study participants underwent 4 30-minute treatments spaced once a week. In the evaluation, we looked at the thickness and the areas of oblique muscles and the adjacent fat deposit based on MRI scan. We looked at the waist and the hip circumference. Digital photographies were also taken. We looked at a 5-point Likert scale, satisfaction, and cohort questionnaire. The data was collected at baseline, after the last treatment, 1 month and 3 months follow-up following the last treatment. This is a sample MRI of a study patient. This was measured at mid L3 vertebrae level, evaluating the thickness of the adipose tissue and the thickness of the oblique muscles. External oblique, internal oblique, and transverse abdominals were evaluated by MRI using standardized MRI study for all participants. In the MRI study, out of the 73 patients that started the study, we ended up with 61 that followed up at 3 months. The MRI study showed an increase, about 29% increase in cross-sectional area and 27% increase in overall thickness for the muscles. For the fat, there is a decrease, a statistically significant decrease in the cross-sectional area and overall thickness of the fat. This is an actual patient's MRI. Is a 48-year-old female, courtesy of Dr. DiBernardo's patient. In this study, the green is looking at the thickness of the oblique muscle and the increase in the thickness of the oblique muscle. Sorry. And then the yellow shows the decrease in the fat of the patient. This is another patient study, again, showing the same thing, it's consistent. There was some secondary results, which were the questionnaires. In these results, which were done at 3 months, a high percentage of the patient reported, about 81% reported feeling more toned in their body, improved appearance, and reported improvement in the treatment area. 72% reported more confident in their clothing after treatment. In terms of comfort, 84% of the patients found the treatment to be very comfortable, and 85% reported none to mild pain during the treatment. This is a patient of mine at my own center, as 43-year-old female, BMI of 28, who had completed the entire study. This was a photo of her 3 months after the completion of the treatment, before and after, essentially. This is another patient who completed the study, showing a significant decrease in the amount of fat on the flanks. In this study, the data showed fat reduction up to 29% and a 27% increase in muscle cross-sectional area. We found high patient satisfaction. There were no significant adverse effect. Therefore, the simultaneous application of HIFEM and RF is a safe and effective, non-invasive alternative to reducing adipose tissue and muscle strengthening in the lateral abdominal area. Thank you very much. I'm open to questions.
That's perfect. Thank you so much for that review of your study. I'm sure that we will have plenty of questions that come up, and anybody, please make sure that you type them into the chat if you have any questions for Dr. Okoro. But I would like to throw the screen over to Dr. Khanna for a second. I know that you've had vast experience with non-surgical body contouring. Every laser, light, and energy source you have tried and used. So what are your thoughts, having been through and read through this study?
Well, thank you, Dr. Okoro, for the summing up the articles that you presented. And, I found it really interesting because, gosh, technology, if we look back at the 30-year career of where we started and where we're at, is kind of crazy, where no surgeon had a device. And at last count, I think I have 69 different devices in my office, which is insane. My husband has a problem, as I like to say. I found it interesting with body contouring. There was a lot of fear, even with cryolipolysis, that surgeons are never going to operate again. We're going to be taken over by technology. And that really hasn't come to fruition. And, I read the study, and I believe that radiofrequency does something. I believe that HIFEM does things. I wouldn't have all these devices if I didn't. But, when we hear these numbers of 29%, 30%, 29% increase in muscle thickening, and when you look at those MRIs and CTs and you look at that little circle, I don't know. I don't see 30%. I mean, I used to be very good at math, and I don't see a 30% change. And that makes me a bit leery. And when I see the photographs, I don't see, granted, you're not seeing a 30% change in the entire body, you're seeing in those specific areas. But still, sometimes I'm still squinting to go, which one is the pre? Which one is the post? Is it that big? And I'm sorry to be mean, but I got to live with this stuff every day. And as surgeons, we have to be more critical, because if they're not happy with their result, we're not the dermatologists, so we're not offering them another treatment. We know we have something in our armamentarium that is much more aggressive and much more concrete that can give a significant change. So, last thing you want to do, maybe you don't love lipo, but free lipo is way worse than lipo. So you don't want to be doing that for sure. So that was one of my concerns. And a couple of things when I was looking at the study, I was missing the demographics kind of laid out to me. I found it, we said 22 to 60. All the photographs were 40, 52, older patients. And I was wondering what was happening with that younger group, because I almost sometimes feel there's a bit of misleading information, especially when you look at some of the advertisements for these type of devices and the body types. I don't know about you guys, but I live in Toronto. Those body types don't exist. And I don't know how we're going to get to those type of Miami beach bodies, because that's not the results that were seeing, and that's how the patients were seeing. And it was funny that even your presentation didn't have those younger ones in there. And that just makes me concerned. I'm not sure, what can I expect and what do I tell my patients and how do I deliver it to them to say that this is going to be an advantage? And I am going to say one last thing, and Jason has 1 million devices. I have 1 million devices, and I do not look like that beach body. So there is, and I would argue most of us don't, and we own the devices. So I'm just a little bit of a negative Nelly, and just putting out some concerns that I have when I'm looking at these devices and the data and what it's saying it's giving us and what that implies clinically to what we get to see.
But Julie, thank you very much for your comment and your concerns. Of course, I mean, at least in my practice, when a patient comes to consult with me about body contouring, and so I always give them, we're going on a road and it's split into two. Left is surgical and right is non-surgical. I'm sure you do the same thing, right?
Yeah.
And I will say liposuction is gold standard. I could contour you better than this can. There are those patients that will never do surgery. We all have those patients. They don't want to go under the knife no matter what. So there are the patients that are open to surgery. So this is for those patients that do not want any surgery under any circumstances, right? Of course, I'm not talking about Q-sculpting, but that's what Q-sculpting, we're still in business, like you said. Q-sculpting did not I will argue that Q-sculpting probably created business for us in some way or the other, right? So this is for those patients, yes. And you have to share this result with them. If they're happy with minimal improvement, then they're the candidates. If they're not, don't offer it to them. The second question talked about the photos. In my practice, the photos I showed were my own patients. Majority of my patients are in their 40s. So I don't cater to 20-year-old patients. I love them for Botox and all that stuff, but majority of my patients are, and I like the fact that they have expandable income. The average patient in my practice is 40 to 50. I don't think this technology will put us out of business. I think we should worry about AI in the future more than technology. That's my response. I hope that was satisfactory.
It was. But can I ask another question, Dr. Okoro? For the members of our society who are here on the talk, and maybe they've invested in M-sculpt, would you tell them, is it worth the investment, the delta change? Because I actually tried to do a bit of a dive and a little bit of research to find good, consistent numbers to show me the difference with HIFEM versus HIFEM and RF. And it was interesting because some of the data was presented by millimeters change, others was presented by percentage change or thickness change or cross-sectional area. And it was actually very hard to find data that was across the board that could be consistent, that I could say, okay, HIFEM alone will give me this amount of change, and then HIFEM with RF will give me this amount. Do you have any sense of that, and what you would recommend to colleagues who already have a cool sculpting device, an M-sculpting device?
M-sculpt, yeah. So I bought the first one, which is a regular M-sculpt, and I have both. I have the regular one and the one with the RF. And there's a quiz popped up. Sorry, I thought somebody was spamming me or something. Sorry. So if you have to have I practice in Atlanta, right? For us, if you don't have these things, then you're behind the 8 ball, right? So I remember when like I said, Cool Sculpting about 2010. Cool Sculpting increased my tummy tuck practice. Okay, I don't know if that makes sense to you. In our environment, if you don't have those kind of high-tech stuff, you wouldn't attract the patient Unfortunately, it does work it doesn't work for everyone. It does not work for everyone. But there are some patients that will come to our practice and they're not candidate for XYZ, but they may be candidate for something else. So it's not for everyone, but they do work, but they're not going to give you a liposuction result. That's how I'll put it. I'm sure Jason Pozner may have a different. Jason, do you want to chime in?
Sure. So the older I get, the more blunt I'm getting. So I'm going to be super blunt. Okay. So we have this device. I had the previous M-Sculpt device too. So these are considered Gen 1 muscle stim devices using a magnet. So Gen 1 was BTL, Gen 2 was Curator, Gen 3 was Lutronic, and Gen 4 is Pure Impact by Softwave. The first one is magnetic. The other three are more electrical stim devices, but each device has a little bit more than the previous device, but only the M-Sculpt is going to give you some fat reduction because of the radio frequency. Okay. So, I give a lot of talks on what to buy and what not to buy. And these muscle stim devices are generally on my don't buy list. Why? Because they're really expensive. And this device is over $300,000 and you can buy them on the used market for $50,000. So there's a reason why people don't want to keep these things. If you want to buy one, buy the Pure Impact. Because it's a cheap upgrade to your soft waves, and you can do multiple muscle groups at the same time. So I kind of like that device because you can do like abs, and you can do abs and quads at the same time, and you can do your rectus muscle and your oblique muscles at the same time. So the problem I have with this is I love the concept of muscle stim. I love the concept of non-surgical fat removal, but the market sucks right now. Our liposuction numbers are way down because of GLP-1 drugs. Our surgical excision numbers are way up. So I've never done so many tummy tucks in my life on all these people who've lost a lot of weight, but regular lipo coming in for regular lipo is a way down compared to what it was before. So in my practice in Florida, which is generally a little older than you're seeing in Atlanta. Okay. And my facial practice is crazy up. So again, it's all these people that lost a lot of weight. And then, if you're opening up a med spa or want to include non-surgical business in your surgical practice, you have to see what other devices are out there to buy. And usually muscle stim is sexy as hell, but it doesn't sell. We have a hard time selling this in the practice. You don't make any money on it. What do people come in for non-surgically? Toxin fillers, resurfacing, pigment, vascular, all the stuff, tightening. Those are things that sell in the practice. So if anyone asks me offline what to buy, I like these devices once you have a full complement of other things. But these salespeople from these companies are super aggressive, and they'll get some unsuspecting person to buy an M-Sculpt Neo, telling them they're going to make zillions of dollars on it, and they don't. Pigment sells, tightening sells. This stuff sells a little bit. So
I think it comes down to what you said, Jason. You've got to be able to see the result. And
Yes.
when you're squinting and you're trying to see the result, it's not saying to you, Dr. Okoro, I'm just saying in general with these technologies that's the problem. And when we're looking at new devices, when you're a younger prospect, you're not like Jason and me, and it sounds like you do, Dr. Okoro, where you have so many devices.
A lot of stuff.
You've got to be really critical, and you've got to be able to stand behind the results you're going to see with your device. And if you can't stand behind it, and as I said, as surgeons, we're not derms. We have to see a result. And we do have the gold standard for this, so it's hard to do a lower standard.
Right.
Yeah,
I
agree with Jason 100%. I mean, right now I'm doing more skin tightening than anything else. Yeah. We try to incorporate the muscle stem with our liposuction patients and tummy tuck patients afterwards, kind of help. That's how we sell it. It is hard to sell in this economy, that's for sure.
Actually, that's a very good point, Dr. Okoro. Where I use it in is a lot of women, when I ask them, when I'm assessing them for their tummy tuck, and I say, can you blow your tummy out fat, suck it in really tight? And when you don't have that good delta change that shows you good muscle strength, I tell them that's still going to happen after I operate on you. So I actually make them do it beforehand, because it's only 4 treatments. they always have more than 2 weeks until their surgical date. I said, do that and you'll see what your resting strength looks like. And my line, and I know Maryam's heard me say this before, this is like me pushing you down the workout line. I'm not replacing the workout line. I'm just giving you a little push to get you a little bit stronger, a little bit faster. And then either you've got to take over with diet and exercise and doing that post-op, or you can continue with M-Sculpt if that's what you want to do.
Yeah. But I don't think people are spending their money on this. I think they're spending their
Yeah.
money on other things. I mean, I
I
can tell you
agree.
what sells in our practice, and if you look at our numbers from this, it's minuscule. And frankly, if I paid 300 grand for one of these devices, I'd be very upset. You know, this is a good device to buy used. You know, MRP has probably sitting on 50 of them in Utah. So there's lots of used devices out there. But again, to me, if you want a tightening device, you know, buy a soft waves and buy pure impact with the muscle stim on soft waves. Its listed price is like 60 grand. And I think that's it's a better device because you could do multiple muscle groups at once. And I can see 60 grand. I just can't see a 300 grand spend for muscle stim. If you want me to spend your money, I'd be happy to spend it other ways, but not with this. And the study,
Jason,
and Stan, your study was great. I mean, Barry is my closest friend in the world, and the study is great. It's well designed. The pictures are great. The data is great. But you know, shit doesn't sell.
Jason, just so we're clear here, because we are doing an ASJ thing, you don't make money on pure impact or soft waves?
Yeah, we do. We make a little bit on pure impact, but again, you know, I have a lot of stuff in the practice. You know, if you got 20 lasers, 50 lasers, sure, buy one. But you know, the problem I have with a lot of these salespeople is they come in your office and they'll tell you the only thing you need if you're a surgeon is a muscle stim device, and to me, that's the last thing you need. You know, unless you only do body contouring, then maybe. But most of us have mixed practices of other things we need. I just don't think it's a good first buy, and I can't stand these sales guys that are super aggressive. And you know, it drives me crazy.
And Dr. Okoro, how do you use this in conjunction? So I know that Dr. Khanna was saying, you know, using it pre-surgical. What are you talking about patients maintenance-wise with this in terms of patients who are using it in isolation and trying to maintain those results? Or are you using it all as well, you know, in conjunction or married with surgery as a kind of pre-treatment, as Dr. Khanna mentioned, or post-treatment maintenance of a tummy tuck or something like that?
Yeah, so we use it two ways. Young people that come into the spa, so we have a spa and a practice. In my surgical practice, for our liposuction patients who do not want to go to the gym, by the way, and they want to have, we remove the fat, we do the liposuction first, and then they want to get tight abdomen, we put them in the spa for the M-Sculpt to get tighter. Our tummy tuck patients, I do it very uniquely. I said, look, I can sew your muscle together. I can't make it strong. If you want to make it strong, you can do that at the gym yourself. They're like, Dr. Okoro, is there any way we can make it faster? So we do have that. We do have. So we do pre-operatively, and then we wait about 6 to 8 weeks. We do post-operatively, and we do have and we call it the M Club. For they come once a month to get a little, just a surge to get back to the gym to help them. That's how we use it.
And how are you using it, Dr. Khanna, in terms of your kind of spectrum? Where are you seeing, you know, I know that you mentioned kind of that prehab concept for those kind of weak rectus muscles before surgery to activate them. Are you using post as well in any patients?
Not many, to be honest with you. And I think, you know, they see such an impact from their tummy tuck, then they're good to go from there, and they're loving the results. So they forget a little bit about the muscle stim. But I'm like Jason, I find it a very a hard sell on its own to show enough of a change to warrant continued treatment, unless you're offering a subscription or multiple treatments, which we've done as well, where we've offered packages for them. But you know what? It's a hard sell. And out of all the devices we have, it's expensive. It's, you know, even offering it, and I'm sure you've done the same, Jason, because you already own it, even offering it at a reduced cost, it takes a room.
Yeah.
It takes a room for half an hour. You know, your ROI on that room even, and on a staff is not great.
And the
So,
magnets are expensive when you have to replace them. I mean, listen, if
yeah,
you owned a high-end gym like a Lifetime, this should be in a Lifetime gym, and it should sell for $50 a treatment. If you could sell it for $50 a treatment in a Lifetime, it would be going from morning till night. No question. But selling it for $250 a treatment, $300 a treatment, you need a series. I mean, it gets expensive. You know, Julie, if you asked me, I'd tell you go to the store and buy a pair of shoes. You'd be much happier with a new pair of shoes than you would with this treatment.
you know my collection, Jason.
Yeah, I do.
But you know, the thing is, the truth is that Jason's absolutely right. We're not seeing the result, that massive result from it. And like I said, I am not sitting here talking to you guys looking like a beach body. So if I own the machine, and I've owned it for a long time, you know, and Jason, I love you, but you don't look like this either. And
Oh, you haven't
we've
seen
got
me without
these
my shirt on lately.
well, you know, you could share.
I got
But you know,
six-pack.
why don't we look like that? Like
Yeah.
if we had you know, we could use it nonstop, and we're not motivated. So if we're not motivated to use it for free, how are we motivating our
Yeah.
patients?
Now, good patients for this, though, like Pure Impact is trying to sell this for patients on GLP-1 drugs who can't exercise, you know, orthopedic problems, bad back problems. No, if you're on those drugs, you should be weight training, because otherwise you will lose fat and muscle. And if you do weight train, you will lose preferentially fat over fat and muscle. That's what we tell all our weight loss patients who take these drugs. And if you can't train, broken foot, bad back injury or something, hey, go for it. Be on this while you're on your GLP-1 drugs. Plus, the other machines will do your biceps and other areas now that these big magnets will not.
And Maryam will know this, that during COVID, my dad had his knee replaced, and he got mad because he said, I'm 83 years old. They want me to strengthen my quad. I'm getting my knee replaced because my leg hurts and I can't do that. I hooked him up.
Yeah.
That was worth it.
Good patient.
That was
really?
worth it.
Yeah.
Wow.
That was worth it. He gained an inch on his quad
Good.
before
Interesting.
surgery.
Yeah,
Okay.
that's interesting. You know, what about age-related skeletal muscle changes? I know that's not necessarily the market that we're trying to target. They're not driving those patients in to get this, but you know, have you seen those changes in, you know, as Dr. Khanna mentioned, in that older patient population who is really depletive of skeletal muscle with those age-related atrophy? Can we see those big changes with these types of devices, either mSculpt or any of the other ones that have been mentioned, you know, on this market spectrum of muscle stimulation?
Diane Duncan did a study on it, on osteopenia, and she showed increased bone density, which is that makes sense. That can make a lot of sense. It could change some people's lives.
I've been treating I have a very close friend who's in his 70s, a physician who walks funny. He has a gait disturbance, and it's most likely due to a sciatic nerve injury from back surgery. He has almost complete atrophy of one of his hamstring muscles. So I put him on this machine and treat his hamstring. I'm not even charging him, and he's too lazy to come in for more because he doesn't see, you know, that's the problem. You know, it's just hard to grab people in your office for this. Again, if you had a high-end gym, no problem. If the price was right, you'd sell us all day long.
Yeah, I mean, when we first got it in Atlanta, it was very, very popular among young people. It really was. I think in all true honesty, most of these machines, as you probably know, within 18 months they fell out of favor. So if you're not an early adopter, I would, you know, this may not be the best time to go get it. But
I agree.
It does work for some people. It is very expensive to purchase. I would not advise somebody that is finishing residency right now that should not be the first machine that you purchase.
Do you think, Dr. Okoro, you can go back and look at your MRIs and also look at visceral fat? Because there was a good study that said the visceral fat decreased too, which, you know, that might be interesting if you're getting a threefold effect.
Yeah, they've quoted that study to me. I have not witnessed that. I would definitely like to get my visceral fat decrease. That's where,
you know, Brian, the late Brian Kinney, good friend of ours, presented the original mSculpt, which showed a decrease in the disc of your rectus diastasis. I thought that was the most interesting side effect of this device we've ever seen. I actually treated someone for it recently. So if for some reason it can decrease your diastasis width, which is pretty interesting because sit-ups won't do that.
Jason, was that significant enough to forego abdominoplasty though.
No, I doubt it. I doubt it. I doubt it. But you know,
I think it was like 1 centimeter, 1.5 centimeter
Yeah.
change was the amount. But it
But
didn't
good for
get
someone-
percentage. It didn't
Right.
get percentage, which is what the important thing
Right.
is there.
It'd be good for someone who doesn't have a lot of skin. You know, someone who has some diastasis who won't have a surgery. But you know, tummy tucks are very straightforward. These people all lose a lot of weight now. They come in with skin hanging off of them. It's an easy, straightforward surgery for all of us.
Yeah.
And Maryam, we've been seeing a lot of activity in the chat box, and the polls have been popping up. So do you want to ask any of the audience questions that have come up and take a run through the polls for us?
Yeah, no, thanks so much for passing it over. So a lot of what's been coming through has been answered in terms of, ideal patients and candidates for this kind of procedures. And I think, we've gotten some real, I would say, raw insights. Sometimes it's insight that's not actually shared. So we want to congratulate everyone and thank everyone for being so honest with their perspective on that. So I think we've kind of covered that. Well, one of the important things that I think is important to cover is there was a technical question with regards to actually for Dr. Okoro, the applicator that's used for this, because I imagine that it sounded like it was a separate applicator from the traditional M-Sculpt or M-Sculpt Neo applications. And that in itself is obviously an additional cost factor to consider, I imagine. So if you could just comment on that, that'd be great.
Yeah, if I could share my screen again, I can show you a picture of the applicator. It was a new design of the applicator. Let me go right here. So it looks just like that, and I'll make sure you can see that. So that's the applicator right there. Can you see right here?
Mm-hmm.
Yeah.
So it's like a clamp. It goes on the posterior and anterior flanks. And the heat is distributed evenly around that. So it's a different applicator. You do have to purchase this. This is an additional purchase.
Now, Stanley, if you shut off the RF and you put it on my bicep and tricep, I'd be super happy.
Well, so that's how it is.
Mm-hmm.
And I tried this in my spa because I didn't want to go through liposuction. I didn't have time, to do it myself. Obviously, I can't do myself. It did work for me. It gave me more abdominal strength when I was doing exercise. It gave me more strength. I tried the traditional one as well. I think, Jason, the thing is, we have these devices in our office and people think that we're just going to take advantage of it. But a lot of times just,
no,
I don't know. I just haven't had the time to go there.
It's when you first get them. Like we got Cool Sculpting in 2009 and I was on it right away. I used it right away. It was cool. And we got M-Sculpt. I was on it right away, but I forget we even have it now. I went on the Pure Impact when we got it just to try it. It was cool. Now I'm like too busy doing stuff. I'd rather go home and jump on my Peloton.
Yeah.
And for those of you who have it, we read in this study very minimal side effect, very few adverse events outside of some blistering, some skin changes that we saw. But certainly when cryolipolysis came around, we weren't talking about PAH until that reared its head and we found out about that. So, in your experience, is there any weird and wonderful that people who have this need to be aware of, or anything that they should be aware of as they're using this or considering utilization of it? Dr. Pozner, then Okoro and Khanna.
I think these are very safe. I haven't heard of any AEs at all from any of these things. No, very safe from all generations, from any manufacturer. Good question.
I haven't seen any significant adverse effect. They are basically painless, except when you activate it, you have to go slow. It can be an intense muscle contraction. I tried doing it standing up one time just to prove I was strong. It was not easy. Just try to do something different, But it is intense muscle contraction. It's well tolerated by patients. No complications so far.
Let's see your abs, Stanley. How you doing?
I got 6 abs, Jason. 6 abs, man.
Julie, anything else to add to that?
No, I would say I would agree with both what Dr. Okoro said and Dr. Pozner said, that really safe device, really easy. I think patients are surprised. They are sore post procedure, and
Good
they're
workout.
sore that night, and they wake up with that, that cramping and sore, like they've had a good workout, and they're a little surprised because it's short, it's quick, and they don't think that's going to happen.
Yeah.
So you do have to just tell them that.
And that's a good thing. I mean, anytime
Yeah,
you do a
it is.
treatment and you know you did it the next day, at least they know they got their money's worth.
Pickle juice, man,
Yeah.
for cramping. It's great.
That's very true. And then just to summarize some of our poll findings, I think that, following this discussion, a lot of our attendees, 70%, don't have the RF HIFEM device in their practice. I'm not necessarily sure that we may have stimulated them to go out and purchase one right now, but at least they will know about what kind of effect they can consider if they were to ever take one on, either fresh or off the used market, and what the ideal patients would be. Patients who would have a weak core to complement a tummy tuck practice or get them strengthening, maybe that age population to help them with the muscle strengthening, the osteopenia, the visceral fat. And honestly, in certain communities, I mean, I'm in California right now, there's a lot of fitness influencers, and I can definitely see them hopping on something like this just to intensify and, intensify their fitness routine. But again, as we've kind of mentioned, we're primarily surgeons, and that's really reflected in our polls. 50% of our participants today don't really have anything aside from they rely mostly on their surgical fat reduction techniques. Quite a few have, the cryolipolysis, which I think is pretty routine given the long history of it. A few do use the injection lipolysis for certain areas, and a few did have the RF lipolysis. And I think the biggest, deterrent to a lot of our surgeons here who've been participating in our chat in terms of acquiring big devices like this is exactly what all of our discussants have laid out, is first and foremost the cost factor, and whether how surgeons themselves can take that on, and how that can be passed on to patients, how the cost of those treatments itself, and also the satisfaction, both from the surgeon perspective and also the patient's perspective, because both really matter. Our patients have to be satisfied in this so that they would continue treatment, the word of mouth aspect, all of that. And also as surgeons, we have to really believe in the treatments that we're giving so that we can there's a certain level of trust that patients have in us, and we only really tend to promote procedures and treatments that we really do believe in and know that can yield a result. So I think those have been very reflective of everything that our experts today have brought forward. But on the plus side of all our discussion is over, most of our participants today, I'm assuming everyone except our experts feels a lot more confident in their knowledge of RF and HIFEM, which is really the goal of having these journal clubs, is to enhance our education.
And I gotta say, thank you for choosing a device to talk about on Journal Club, because this is something that we usually don't get a lot of discussion on. And I think it's very valuable that our members look at this stuff, because they are buying these things and sometimes they don't know what to buy, and these decisions are expensive and can be a mistake. So I think it's very good to have, I think you probably picked the two bluntest people you possibly could, being Julie, to discuss this though.
No, and that's the whole point of doing these. And, it's great to see this type of research come out, and good quality, high quality research with numbers and data that we can drive. We say 20, 30%, we throw those things out in terms of relative numbers. And, this gives actual data behind that, and actual meaning that we can show our patients and have a discussion about the utility and meaning of 20 or 30%. And is that going to be useful or not? One thing, just, for completeness sake, as we, post these online, these live forever, I'd like to just go through all of our speakers, just in terms of any disclosures from any of the companies that were mentioned tonight. Dr. Pozner, do you receive any funding specifically from any of the HIFEM companies?
We did some work with BTL in the past. I don't work with Curator. I did work with Electronic. I don't have the device, and I do work with Softwaves, give some lectures for them. But I have a Softwaves and I have a Pure Impact. I paid for both, did not get them for free.
Perfect. Dr. Okoro, yourself?
Yeah, I paid for all of my devices, BTL devices. I did not get them free. I don't receive any any money from them.
Dr. Khanna.
Yeah, I've paid for my BTL device and I don't get any money for them.
Perfect. Well, I think it was a fantastic discussion. I really appreciate you all taking the time to showcase your research and to share your expertise with us. We're also fortunate tonight to be joined by Dr. Al Ali, who is the editor-in-chief of ASJ Open Forum. And we've had some exciting news from ASJ Open Forum recently in regards to our impact factor. So I'd like to hand the microphone over to Dr. Ali for a brief moment, and hopefully we can encourage some more submissions to ASJ Open Forum in the future.
Thank you, Ryan, and thank you to all my friends on the call, on the Zoom call tonight. It's wonderful to see these discussions, and I really love the honesty because there are a lot of young people in the audience, and it's very, very hard to go out there and spend $300,000 when you're just starting your practice. And believe me, and I'm sure everybody has said this before, these salespeople are going to give you a song and dance. You can make it back in 6 months and this and that and all that stuff. But this is how you find out the information. You really need to talk to people who have it and really move, before you spend that much money, make sure you really understand what it means to you. So along the impact factor, we are very proud to have just gotten the impact factor for ASJ Open Forum. This is obviously work that was started by Dr. Kinkle and Dr. Nahai. We just happen to, like I said in an email to my friends, that I feel like I've received the goose that laid the golden egg already. And I hope that this helps people think of ASJ Open Forum as a place to turn in their articles. Because now that you have an impact factor, your articles are going to, get a lot more views. And for those of you who are not very familiar with the difference between ASJ and ASJ Open Forum, any open forum or open access journal has anybody in the world can look at those articles. You don't even have to have a subscription to the journal. You don't even have to be a doctor, as long as you just kind of have a way of getting onto the website. So the number of people who will get to see your publications is very high compared to any regular journal, even our own ASJ. Now, ASJs are definitely our golden goose, but this is very, very exciting for all of us and for the family who are involved in, and a lot of people on this call are involved with ASJ Open Forum. And one last thing I'll leave you with is, this is, I believe, Ryan's last, I guess, I don't know what you call this event, but
Moderation of the journal club and
moderation of the journal
leading
club, right? And for those of you who don't know Ryan, many of you I think do, he does such a wonderful job, and so we have asked him to, and he's accepted to become the associate editor of ASJ Open Forum, and we're very proud and lucky to have Ryan take that job on, and I'm sure he's going to make us much, much better than we are. And we're very excited for him, and we're excited for us that he's accepted that, and just wanted to make sure that everybody understood Ryan is not going out to pasture. He's just in a harder job to do. So congratulate him. He deserves it. He does a wonderful job, and we're very, very glad to have him on board.
Thank you very much. I really appreciate that, Dr. Ali. It's going to be an exciting opportunity and to take this impact factor and continue to grow it. So for any of you who are thinking about submitting, please think of ASJ Open Forum. If you have friends who are thinking of submitting, keep it in mind. Anybody who's affiliated with ASJ, we're happy to send you slides and share it at any meetings you talk at, because we really want to drive this up and make it the premier open access journal in the aesthetic surgery space, and if not all of surgery. So with that, I will close it out. We're getting towards the top of the hour. So thank you to our speakers. Thank you to our discussants. Thank you to everybody who took the time to tune in. And make sure you tune in for the next YAPS Journal Club session, which will be at the beginning of December. And I'm excited to hand the reins over officially to Dr. Zamani for her first session, which will be at the beginning of 25 with Dr. Denise Sarhadi, as things will be growing and evolving. I think it's going to continue to develop into something wonderful, and I can't wait to see all of the excellent work that you and Denise do moving forward. So everybody stay safe, stay healthy, have a great night, and look forward to catching up soon.
Thank you.
Thank you,
Thank you.
everyone, for tuning in. Thanks, Ryan.
Yeah.
Bye.